Hello, my name is Marcel. On my last video, I spoke about the material that you can use while you are preparing for the APMLE. Today, I will be talking specifically about pharmacology. When I was a second year student, I used to tutor in pharmacology. So that's what I will be basing off those high yield concepts based on my tutoring experience and based on my population. The first topic that is high yield in pharmacology, and you won't be surprised, is antibiotic. Make sure you know in general, make sure you know mechanism of action, popular and well-known cited side effects. Don't go hunt from those side effects that are weird and like something that happens every I don't know when. So know those well-established side effects if there are any allergies and counterindications. You need to know if they are bactericidal or static. The first family that I will be talking about is penicillin. High yield concept about penicillin is they give you a question and in the stem they tell you that the patient has an infection, so you will immediately link that infection. Okay, first that patient can be treated using penicillin. But then the question stem will continue by telling you the patient has allergies from penicillin, and at that point you need to make sure that you get a cross out penicillin from your answer choices and choose a medication that does not violate this allergy. So usually you will choose a medication that is monobactam or carbapenem. So the patient is not going to have an issue by having that allergy. So you don't violate the allergy, and then at the same time you are able to treat that infection. Penicillin is a cidal. Usually the penicillin family is a drug of choice for meningitis and gonorrhea. Just make sure you know those ones. If you see me looking at the side, I'm using my notes, so just so you know. The next family is cephalosporin. Cephalosporin, there are 5 generations. 1 through 5. Make sure you know the medication that is 4th generation and know the medication that is 5th generation. You'll be like, what do I need to know about them? Know the name. I know it's really simple, and you'll be like, what do you know the name? Know the name, know the mechanism of action, and what they are used for. So, the name of the 4th generation medication is cefepime. The 5th generation one is the ceftaroline fosamail. I just call it the mel, and I know it has it's a combined name. It's not one name. That's how I know it. And usually the 5th generation is used for MRSA, CAP, or complicated skin infections. Just know that as you move from 2nd and 3rd, you are switching from gram-positive, gram-negative, and then you are getting 3rd generation is more of broad spectrum. Just keep those ones in mind as you are thinking of the cephalosporin. This family is bactericidal. You need to know what is the difference between bactericidal versus bacteriostatic. Static keeps the growth rate of the bacteria where it is. The bacteria will still exist, but there will be no growth going on. With cidal, it's gonna wipe out the bacteria, or at least theoretically that's what they actually do. Okay, the next family is the cell wall inhibitor. Popular medication that belongs to this family is the vancomycin. So, cell wall inhibitor, this is the mechanism of action, and if we are offending the cell wall, you can think it makes sense if I tell you this family is bactericidal. This is the one medication. Make sure you know the vancomycin mechanism of action, which is diala. This is very popular. Popular question about vancomycin. The question would say, a patient that has been in the hospital, and it would tell you that it was extended stay in the hospital and now the patient is experiencing, and it will list like a bunch of side effects. Usually a popular side effect is diarrhea, and then so which medication you think the patient was on. and you can tell it was vancomycin. There are other medications that belong to this family, but again, the goal of this video is to tell you the high-yield, popular medications. Okay, sulfur drugs. Those ones are bacteriostatic. Make sure that the patient does not have a sulfur allergies. That would be, giving that patient sulfur medication would be counterindicated. So make sure you know the allergies if the patient has one. Inhibitor of protein synthesis family. This is static kind of antibiotic, and that would be the macrolides. What belongs to the macrolides is the erythromycin, azithromycin, and the clarithromycin. Make sure again you know the mechanism of action. Those ones are they inhibit 50 on the tRNA. The next antibiotic family is the aminoglycosides. Those are bacteriostatic. They act on tRNA 30 subunit. Next family is protein inhibitor. Those ones are broad spectrum protein inhibitor medication. Chloramphenicol. This medication is usually the bridesmaid. It is never the bride, which means it's usually an adjunct. That's something our professor used to tell us. The next medication is the tetracycline. This one is bacteriostatic. It acts on subunit 30. This is well-known medication. For sure, we'll have a test question about it. It treats a wide range of infection. When in doubt, give them tetracycline. Like, it's a drug of choice for like a really long list of infections. Next medication is the fluoroquinolone. This medication inhibits the DNA kinase, which makes it bactericidal. One popular medication within this family is Cipro. Cipro, when you think of Cipro, you think of rupturing a tendon, which is Achilles tendon. That's like a very popular concept. And that was it for the antibacterial. The second big topic in pharmacology is the antifungal medication. And those are also popular in the field of podiatry for mycotic nails, etc. For antifungal, again, you need to know mechanism of action, what they are used for, and side effects. The side effects for antifungal and equivalently for antibacterial, when they make a mention of like prolonging QRS or shortens QRS, make a note of that. This is a harm-related side effect or a general effect that I would highly recommend that you know it. So back to antifungal. With antifungal, there is two main categories: systemic versus local infections. So for systemic infections, we do amphotericin B and the azoles. Amphotericin B is the first systemic antifungal. This one basically it interacts with the sterol protein that's on the fungus, which makes it fungicidal. I don't know if I just made up that word, but the point is it is a cidal medication. It's not a static kind of medication. Next family is the azoles, and those are those are fungostatics. Topical or local antifungal, glycopholin. Make sure you know the mechanism of action, which binds to the microtubule and destroy the mitotic spindles. This is like really high yield concept, which is, again, that's a mechanism of action. And then the trombinifene. Trombinifene, this one interferes with the estrol biosynthesis, which is specifically the squalene, and this one is used for onychomycosis. I hope I addressed most of the questions that I got about high yield concepts. If you have questions or suggestions, please feel free to contact me on my email or my Instagram. Thank you for watching and see you on the next video. Bye now.